That's Nyla Payton. She's a mom of 3, and her employer is a nonprofit hospital.
I'm giving blood, sweat, and tears to UPMC, all for me to give my hard-earned money back to them. That's not right.
UPMC is a healthcare giant. It employs more than 92,000 people, has an operating revenue of about $26 billion. And as a nonprofit, it's technically supposed to provide affordable healthcare to the people who need it most. But its flagship hospital recently made headlines for being the least charitable nonprofit hospital in the country.
The CEOs of UPMC make millions, while its workers are barely making a living wage at all.
There are plenty of people who have been completely failed by our medical system in the city. They have more money than they know what to do with for years.
This is a story about how one hospital grew into a vast medical empire by destroying its competition, exploiting its workers, and saddling patients with medical debt. But it's also a bigger story about how nonprofit hospitals across the country have transformed over the last few decades, from once charitable institutions into engines of profit. And all of it is powered by your tax dollars. Nonprofit hospitals have been around for a long time, but they used to have a noble mission. This is UPMC Presbyterian, the first UPMC hospital, founded in 1893. Like most hospitals at the time, it was largely focused on one thing: providing affordable medical care for anyone who needed it.
In 1900, the vast majority of hospitals were charitable institutions. They were small community boards. They were religious hospitals and institutions.
In theory, that's the reason why nonprofit hospitals are exempt from paying taxes.
And that benefit is an exchange for the idea that they're serving their communities.
But in the last few decades, things have changed. In 1969, the tax code was modified so that a hospital didn't have to pay taxes as long as it was promoting health. Charity care became optional, and nonprofit hospitals started looking a lot more like corporations.
In the late 1970s and early 80s, boards began to think and feel more like a for-profit enterprise. We have a lot more MBAs and a lot fewer nurses and doctors.
Today, nonprofit hospitals are big business.
So-called nonprofit hospitals are actually making a lot of money.
Acting more like a Fortune 500 company, reaping big profits.
There are institutions that are legally nonprofit that are making millions and millions of dollars, but what's being reported as their charitable contribution is generally quite modest.
So Vikas Saini and his colleagues at the Lown Institute decided to take a closer look at just how far some nonprofit hospitals have strayed from their original mandate of giving back. They looked at over 1,700 nonprofit hospitals nationwide and calculated what they call the fair share spending of each. If a hospital took more money in tax breaks than it gave back to the community, it had a fair share deficit. And one hospital came out on top.
UPMC in Pittsburgh has a fair share deficit for the whole system of $490 million. That's a lot of money. That would go a long way to affecting the health of the surrounding community, maybe the entire state of Pennsylvania.
Meanwhile, UPMC's former CEO made $12.9 million in 2021.
It's a nonprofit hospital paying exorbitant executive pay.
Well, that's your judgment of it. I think my board determines what the appropriate compensation is for me and for all the other executives.
In total, top executives raked in $225 million in 2021, more than double what UPMC spent on charity care that year. That's enough money to keep hundreds of rural hospitals open, or to cancel the medical debt of hundreds of thousands of patients.
Kind of scared to even look at these. And it's crazy when you work for UPMC, you have to see UPMC doctors, but you're in medical debt to UPMC because they're your health plan. It's crazy. Roman was born June 5th, 2018. He was 8 pounds, 13 ounces. His glucose level started fluctuating, so he had to be put in the NICU. The first week of his life, he was in the NICU, watching him in an incubator, not being able to take my baby home. It was heartbreaking.
According to UPMC's own policy, Nyla should have received this care for free, given her income at the time. But she didn't.
UPMC collections calling me, letting me know I owed over $1,000 in medical debt for my prenatal and postnatal care. My reaction was, how am I gonna pay this? I already don't make enough to make ends meet, but yet I have to figure out a way to pay these extra bills. And I hate to say it, but a lot of us workers, we don't do it intentionally, but we sweep those bills under the rug because we have other bills that are at the forefront of our brains.
A recent survey found that 36% of UPMC workers are in medical debt to their employer. UPMC is able to get away with this in part because it's the biggest gig in town.
UPMC has ambitious plans for the future of Pittsburgh's medical community.
In just the last 10 years, UPMC has grown from 12 hospitals to over 40.
Amazon leaped over the traditional retailing giants, and now Amazon, in fact, is retailing. UPMC desires to be the Amazon of healthcare.
UPMC is now the largest healthcare provider in the state, and that gives it a lot of power over patients and over workers.
In this city, there's one big name when it comes to where are the jobs, and that's UPMC. My name is Joel. I work at UPMC Children's as a nurse. I'm just hoping that the patient load isn't too wild right now. It's been a little up and down lately. After COVID, we were working with severely reduced staff. Those of us who were left were picking up new parts of the job, new expectations at work, obviously not for any new compensation. We've been told the whole time that help is coming, that things are going to improve. But that's just not the reality we've seen. My wife has noticed this. You're always either working or asleep. Yeah, I know. Not how I want it either, but you do what you have to.
Understaffing is pervasive at UPMC, and it's only become worse as the hospital has gained more and more market power. This reality is exhausting for workers and potentially dangerous for patients.
In my unit at UPMC, we have some quite sick kids. We've had times where, like, you're in a room, you're so busy trying to get one kid stable, and you hear a yell in the background. There's nothing scarier than thinking that you weren't there when one of these children needed you. We're in this because we care about our patients, and we need to have the resources to keep them safe.
That was exhilarating. Very exhilarating. That was actually the day Summer Lee led us into the UPMC board meeting.
This is a public entity. This is a charity. We have people who are literally outside throwing up because they are looking for the right to come in here to address this board. Here are these workers, largely low-wage workers, who have been organizing. They have been going up against this giant, and they're doing it on behalf of each and every one of us, to make sure that there's safe staffing levels, to make sure that our family members, our loved ones, are receiving the care that they deserve from a world-class medical center like UPMC. Here we have an industry that is able to grow and grow and grow while leaving the very communities that it should be serving behind.
In May 2023, a coalition of unions filed an antitrust complaint with the Justice Department, accusing UPMC of using its market power to harm workers.
We need the DOJ to investigate UPMC.
But even if UPMC started to face real accountability, it wouldn't solve everything. Because it's just one example of a much broader crisis. 3/4 of nonprofit hospitals are getting more in tax breaks than they're spending on communities. That's enough money to cancel the medical debt of 18 million Americans. And it's enough to raise big questions about who this system really serves, and what it will take to fight back.
That's the union, baby. Once I found my voice, it was a thrilling thing. I am here to be a leader and make sure that we get what we need. Safer staffing, affordable health care, a livable wage. We need to be heard. It's our time.